Hi everyone, my name is Abigail Waterman, and today I'm going to be discussing the Picture Exchange Communication System with you, which is also known as PECS. This system consists of 6 phases to help instruct individuals with language and social communication impairments communicate their needs and desires. Now, there is no defined age or population that says this program will work best for, but there has been demonstrated effectiveness with populations such as those with autism or pervasive developmental disorder or Rett syndrome. Now, these individuals, it's really important to remember that these individuals may benefit from this program, but their clinical diagnosis should not be the sole basis on which their communication program is based. Now, the PECS program is comprised of a whole bunch of pictures and icons that we know the client desires or activities that they desire. So, for example, in this book we have a whole bunch of pictures of characters that they like, items that they like, activities that they like, animals that they like and can identify. So in phase 1 of this program, we have 2 staff members working with the client. One sits in front of the client at a table. This all happens seated. And another staff member is standing or sitting right behind the client. And the staff member that sits in front has a well-known preferred item or food that they have, and in order to entice the client, they take a little small bite of the food, and that kind of gets the client's attention. And once they get the attention, the client may reach for the item, and when that happens, the staff member standing behind the client will help provide a physical prompt to the actual icon that's on the table that represents the preferred item that they have. And they'll help the client pick it up in their hand, and they'll help them drop the item into the staff member sitting across from them's open hand. So once they say that, like popcorn, you say, yes, that's popcorn, and then you give them popcorn. Now, in phase 2, the individual is taught to increase the frequency of exchanges as well as move further and further to retrieve and exchange the pictures with their communication partner. We're trying to be more persistent in communicating requests and traveling further different distances. So it's also important to remember in this phase that we're trying really hard not to provide any sort of cues. So we don't want to make facial expressions, make eye contact, just to kind of help the client along. We want them to really understand this. So I have my PECS book that has probably 2 little PECS, maybe 1, that we know the client really likes, and it's just 5 feet away at that table. So the client, in order to gain access to that item, they're going to go and pick up the icon and bring it to me, and I would say, yes, that's popcorn, and then I get them popcorn. Now, in phase 3, the individual or client is taught to discriminate among a variety of pictures. So you might have 2 or 3 pictures that you know are preferred items or activities for them. We're kind of trying to help them differentiate between the items that they desire at this point. So in this phase, we're sitting across from the client again, and we're going to ask them a question or say, show me the tablet. And they have the 3 icons, so they have a popcorn, a tablet, and the cars. So they're going to determine which PEC is the tablet PEC. So if they touch the tablet PEC and you say, yes, that's tablet, but if they reach for the incorrect one, like the toy car one, we don't make any sort of verbal or vocal feedback. Now in phase 4, the individual is taught to communicate in complete sentences. You'll provide them with a sentence strip, which can be found at the very bottom of this right here, and often it comes apart, but this one just doesn't at the moment. So you provide them with that, and they have certain sentence structures. So for example, we have the I want card, and sometimes we have an I don't want or I'm all done sort of PEC. So at this point, you're trying to get them to construct the sentences themselves. So you're going to help them take the I want PEC and put it on that little communication strip, and if they want the tablet or the popcorn or the toy cars, you're going to put the PEC right there, and you're going to say, yes, I want toy cars, and then you're going to give them that information. Now, once they learn this portion, you can increase the descriptors that you're using. So instead of just I want toy cars, it might be I want blue toy cars. So just differentiating little characteristics there. Now, in phase 5, the individual is taught to answer questions using a combination of pictures, icons, and words. So at this point, you're teaching the children or clients to make spontaneous requests and respond to questions. So you might ask them, what do you want? And at this point, they're saying, I want toy cars. So you want them to say it at the same time that they're making this sentence, which you might have some time in between, like 2 or 3 seconds that they're saying, I want, and then there's 2 or 3 seconds, and then toy cars. So that's fine. That's pretty normal, or yeah, typical. Now, in the final phase, phase 6, the individual is taught to use their pictures, icons, and verbal words to make comments. So you might be walking outside with their client, and you say, what do you hear? And you have an I hear peck and a bird peck, and they say, I hear birds. And you say, yes, that's right. So your communication partner is going to continue making opportunities like this for the client to make comments and spontaneously respond until they can do this on their own. Now, this program only has 6 defined phases, but you can continue on and modify things as you need. Now, as I stated earlier in this video, there is no specific population that should use this communication system. It can work for many different populations with different disorders. It really depends on the needs of the individual. And so you need to really determine if this communication system will work based on the individual needs and the current language abilities. Thanks.